Pressair is a multi-dose dry powdered inhaler or DPI delivery device. Patients will receive the device in a sealed package which must be opened just prior to the first use. If multiple packages are provided to the patient at the same time, like a 3-month supply of medication, the extra inhalers should remain in the sealed package until ready to use. Once the package is opened, the wrapper is no longer needed and can be discarded. The demonstration devices used by Mary and Mrs. Ryan in this video have already been removed from the sealed packages and are ready to use. Let's watch as Mary explains to Mrs. Ryan how to use this device.
Hi Mrs. Ryan, I'm Mary.
Hi Mary.
And I am here today to show you how to use this new medication delivery device. It's Pressair.
Okay.
And it's a dry powdered inhaler. Okay. It's fairly simple. The front part of it here is the mouthpiece cover. So before we can use it, we'll need to remove that. You can see the little arrows here on the side. Holding and pressing at the same time and pulling.
Okay.
As Mary mentions, the dust cap must be removed before the device can be used. There are arrows on the sides of this dust cap which must be squeezed to release the cap so it can be removed easily.
Just remove the cap, put it down, and that's the mouthpiece.
Okay.
And as you can see, you want to look inside there to make sure there aren't any little broken plastic pieces or anything obstructing the hole there. Okay. The next thing is you see the red indicator, that's the dose indicator, and the very top is the number of doses that you that are loaded into this device.
Okay.
You don't put anything into it. So let me show you and talk to you and go through this, and you can work with me at the same time.
Okay.
It's real important that you don't blow into this once it's loaded with medication, and I'll show you how to load that again. Because again, it's a dry powder, and if you blow into it and moisture gets in there, then it'll get all
gummed up.
Exactly.
Like all DPIs, patients should not breathe into the device because the moisture from their breath may result in clumping of the powder. This clumped powder may get stuck in the inhaler and will not be able to be delivered deep into the lungs.
So this button on top, and this is just a demonstration device, but in the real device it's green.
Great, my color.
Okay. And so to load the dose, you'll press it down once, and you'll see the little loading dose indicator, and it turns from red to green.
Cool.
Is that what yours looks like?
Yeah.
Okay.
It's important to tell patients not to shake the device or tip it upside down after the button has been pushed so that the dry powder is not lost from the device. Of note, for patients who have red-green color blindness, the red marker appears darker and the green marker looks lighter. Therefore, most patients will be able to see a difference in the two shades, even if they are unable to see the distinct red and green colors.
And then in order to take the medication, you'll need to empty your lungs by blowing away from the device so that, again, you're not blowing into it. And then putting this into your mouth, getting a good seal, and taking a fast breath in and holding it for 10 seconds.
Similar to all other DPIs, patients must take a fast, deep breath with enough inspiratory force to inhale the fine, dry powder deep into the lungs.
And make sure that you don't put your finger on here because we've already got the dose loaded. Okay?
Okay.
So empty your lungs. Okay, did yours turn red?
Yes.
Good, good. And as you can see, this little number at the top, that's the number of doses, and it counts down in increments of 10.
Oh.
So when it gets to 10, I believe it also turns a red color, and that means that it would be time for you to get a refill.
I see.
It's important to note and to tell patients that the dose indicator moves down very slowly and displays intervals of 10. Therefore, the currently available device starts at 60 and then goes down to 50, then 40, and so on. There's a red band that appears in the dose indicator area when there are 10 or fewer doses left. The device should be discarded when the dose indicator reads 0, when the device locks, or 45 days after the device was removed from the sealed package, whichever comes first.
So let me let you demonstrate this to me again.
Wow, so I have to do everything now, right? Start from the
beginning.
beginning. Okay, first thing I do is take the dust cap off, and I need to load it, right?
Yes.
So I click it fast and it turns green, so it's
Good.
loaded.
Good.
So now I empty my lungs.
Oh, it didn't turn red, did it? You notice that?
Yeah. Does that mean I did something
That
bad?
You did something wrong, and once you've clicked this just one time, that means your dose is already loaded. And when you put it into your mouth to take that dose, you don't want to press this again.
Oh.
And that's what you did. So
Okay.
just kind of keep your fingers off this.
Okay.
Let's try it one more time.
Patients may forget that the button on this dry powdered inhaler should not be pressed during inspiration because they may confuse the technique for the Pressair inhaler with their metered dose inhaler or MDI device. This is one of the main reasons that the DPI device has the red-green indicator. If the indicator stays green, then the patient did not receive the dose of medication. Mrs. Ryan's mistake when using this device illustrates the importance of having the patient demonstrate her understanding of the proper use without coaching from the healthcare professional, which is called return demonstration.
Okay.
Okay. Great job. I want to breathe with you when you do that.
It only took one more try.
That's great. Pretty simple, huh?
Yeah, I like this. It's easy.
And the cover obviously protects it, but you'll want to clean around just with a dry cloth. Again, it's a dry powder, so you don't want to put this in water or anything.
Okay.
And the dose counter, remember to, when it gets to 10 or into the red, then you'll also want to go ahead and get your refill.
Okay.
Any other questions?
Hey, I like it. It's simple. Thanks, Mary.
You're welcome.
In summary, the Pressair DPI contains multiple doses of medication. Common mistakes that patients may make with this device include pressing and holding the green button at the same time they are inhaling, tipping the device upside down or shaking the device after the dose is loaded, breathing or blowing into the device, breathing in too slowly or not deeply enough, not holding their breath for up to 10 seconds, and or trying to clean the device by placing it in water. Because this is a dry powder inhaler, the device should be kept dry and moisture should not be allowed to get into the device. Therefore, it's very important to address these potential mistakes when teaching patients about the use of this device. It is also critical to have the patient demonstrate the proper steps without coaching to ensure that she will be able to appropriately take her medicine when she goes home. Finally, the device should be discarded when the dose indicator reaches 0, when the green button locks down, or 45 days after the device is removed from the sealed package, whichever comes first.